Hi, I'm Dr. Nicholas Conger. I'm an infectious disease doctor at Memorial Hospital in Gulfport, and I'm here to answer questions about COVID-19. I believe we have a list of questions that have been accumulated from people, with what people out there want to hear and want answered about COVID-19.
Thank you, Dr. Conger. Our first question is, why are vaccinated people still getting the virus?
So the primary goal of any vaccination is to prevent illness. The secondary goal is to if you do have a breakthrough illness, have it be mild, and then the tertiary goal or the third level goal will be to not die from the infection. These vaccines are very effective, but as these new variants are coming out, they're a little bit less effective at preventing illness, and so we are seeing some more breakthrough infections. That said, these breakthrough infections are very mild, and one can easily tell the difference between someone who's been vaccinated having a very mild infection and someone who is not vaccinated who's having a very severe infection.
So why is the vaccine so important if you can still transmit the virus?
So with the first strain that was going around when the vaccines first came out, they were about 90 to 95% effective at preventing illness. There are more breakthrough infections, but we're seeing about 20% breakthrough infection rate. That still means that 80% of vaccinated people are a dead end, that the virus just can't get past them. In addition, while it's possible for vaccinated people who do have a mild breakthrough infection to transmit the virus, they are much, much less contagious, and so you're going to have less transmission. And so the vaccines are still very important and the most effective tool we have at preventing the spread of these variants as they come through.
Should someone who's had COVID before still get vaccinated?
So that's a controversial question, and my answer actually kind of goes against CDC guidance. The CDC says after 3 months of infection, you can get vaccinated, and I agree with that statement. You can get vaccinated. Whether you should or not is controversial because people with natural infection actually are very well protected, and I see a lot fewer. It's extremely rare to see someone have a second true infection from COVID-19. So it's much more likely to see these mild breakthrough infections with the vaccine. Studies have shown that people have cells that can fight infection up to 9 months to a year after infection. And so to me, someone who's had natural infection and gotten over COVID-19 is just as protected as someone who's been vaccinated.
Are vaccines safe for children and young men and women of childbearing age?
So the vaccines have been proven to be safe in children. They've been studied in children down to age 12. As I've said before, with children, the infection up until now has been quite mild, and so there's always a balancing act between, even though the vaccine is very, very safe and side effects are mild, if the infection is mild, to me it was a choice of parents whether to vaccinate their children or not. This Delta wave that's going through now, though, we are seeing much more infection in teenage kids in the over 12 age group, and we're seeing more severe infection in children. So I think that the balance is swayed a little bit, and so they are proven to be safe in children, and if parents choose to get them from their children, they should feel comfortable with that. As far as women of childbearing age, there's really no study that's shown any ill effect in that age group. I know that there's a lot of information out there on the internet that suggests otherwise, but there's no appreciable risk for those people as well.
So what is in the vaccine?
So the COVID-19 vaccines, there's two different types. The Moderna and the Pfizer vaccines have messenger RNA strands, and that's really it. Other than that, it's the vehicle that they're delivered in. The messenger RNA is in all of our cells and is what your cell uses to make proteins. And the proteins are the building block, of our bodies. And so all those vaccines do is they put that messenger RNA strand into the muscle cells of your arm, and it teaches your body how to make a spike protein. And so your body starts making spike protein, which is on the virus. And immediately your body recognizes that spike protein is not supposed to be there. So your body makes an antibody to counteract that spike protein. And that's how the Moderna and Pfizer vaccines work. There's not a lot much else in them other than the messenger RNA and the material needed to deliver the vaccine. The Johnson & Johnson is a little bit different. The Johnson & Johnson vaccine is actually a shell of a different virus called adenovirus that is stripped of its ability to make you sick, other than to gain entry into the cell, and it has a DNA that teaches your body how to make a spike protein. And so that goes into your body's cell, and then the DNA is translated into RNA, and then you build the spike protein. So the end result is your body makes an antibody against spike protein. Neither vaccine, types of vaccine, contain any live virus.
Thank you. How contagious is the Delta variant?
So the Delta variant is quite contagious. Coronavirus that spread last year was about twice as contagious as the flu. This Delta variant is about twice as contagious as a previous COVID-19 virus. And so it's about 4 times as contagious. And so they say that everyone who's infected with the Delta variant has a potential to infect 3 to 6 other people. And that's quite a bit. And that's why we are seeing such rapid increases in the number of infected people.
Will a booster be necessary for the COVID-19 vaccine?
I highly anticipate that a booster will be recommended by all authorities soon. Exactly what timing that booster will be recommended is unclear. And obviously, if the virus mutates so much that the vaccines become significantly less effective, then a booster to go after those new variants is very possible as well. They are already recommending booster vaccinations for people who are immune compromised, who may not have even responded to the first vaccine. That's a moving target and things are changing, but I fully anticipate booster vaccines will be recommended.
Do you see people having to receive a booster each year, similar to the flu vaccine?
Yes, I do see that in the short term. Now, there may be potentially a time when the risk is so low that that's not necessary, but until COVID becomes a mild seasonal illness, which I hope it does eventually, yes, I think the people will most likely be recommended to get an annual vaccine, but that's not a formal recommendation yet.
How long is the vaccine effective for?
Well, so we kind of answered that with the previous question. People who've been vaccinated have good amounts of antibody, at least 6 to 9 months and probably close to 12 months. What we are learning is at what level is someone protected so that they don't have those breakthrough infections, or if they do, they're very mild. So I don't have a definitive answer for that question.
Can you explain why the vaccine is safe?
So, the vaccine is safe. We talked about how there's not a whole lot in it other than, DNA and RNA, which is normally in your body. And so they're very safe. And millions of people worldwide have received the vaccines with very minimal, truly documented side effects. And so these vaccines are, compared to historical vaccines, they are incredibly effective and with very minimal side effects.
So if I've tested positive for COVID-19, what medicines or vitamins do you recommend that I use?
And so historically, we don't have good luck treating viruses. Viruses tend to just run their course. So the vitamin C's and the vitamin D's are helpful to boost your immune system. Excuse me, zinc may help as well. Other than that, the other things we do are kind of adjuncts. Like some people get placed on antibiotics. Well, that's just in case there's a bacterial infection, but almost always the pneumonia is the virus itself. Now, some of these antibiotics like azithromycin and doxycycline have anti-inflammatory properties. What's been proven to be effective is in the second week of illness, if you are having low oxygen and significant inflammation of the lungs, steroids at that point have been shown to be helpful at minimizing the length of the disease. Now, if you're severely ill and you get hospitalized, there's other medications we may use. Finally, the monoclonal antibody is an infusion that we're seeing excellent results with, but that has to be given early. We've been giving it within 10 days of illness, but now we're really recommending within 7 days of illness. And so a monoclonal antibody infusion given early, we think can alter the trajectory and prevent hospitalization and death.
Do you know of any possible long-term side effects from the vaccine?
So we haven't seen significant long-term side effects of the vaccine, which is good. Historically, other vaccines that have had problems with long-term side effects had a lot of problems with short-term side effects, and we're just not seeing that with these vaccinations. And so, yes, the jury is still out. People haven't been vaccine recipients for a long period of time, but we're not seeing any markers or any indication that there will be long-term effects of the COVID-19 vaccines.
Great. And for comparison's sake, can you explain long-term effects of COVID versus the vaccine?
So the long-term effects of COVID are clear. Yes, many people will fully recover from COVID, and for some people it will be just a very mild illness, and some people have asymptomatic or just extremely mild infections, and they're just fine. But there are a subset of patients, and it's not a small number, that have ongoing issues with shortness of breath, ongoing issues with chronic cough, chronic fatigue, and many patients are not back to their baseline. So I definitely feel that the long-term side effects of the virus are absolutely real. I see it every day, whereas the long-term effects of the vaccines are just theoretical, and I've not seen them yet.
Great, and we answered this a little bit earlier, but we have some new viewers. They're curious if the vaccine impacts fertility for women.
Yeah, I don't believe the vaccine impacts fertility for women. In fact, it's recommended that pregnant women get the vaccine to not get, significantly ill from COVID while they're pregnant.
We have another question from our viewers. They're asking if cloth masks are as effective as N95 masks, or would you recommend one or the other?
So that's a good question, because I know that mask debates are very emotional for some, and to me it's more of a political debate and somewhat of a distraction. So I'll just tell you what I believe to be true for masks. So if you want to prevent infection, the best mask is an N95 mask, and that's not something we've recommended the general public in the past buy or keep. But if you're high risk to get really sick from COVID-19, I would recommend trying to obtain an N95 mask. They work the best. The next best is a KN95 mask. Most of those are made in China, and they're not as good as N95 masks. And there is some caution that there are some counterfeit KN95s out there. So if you look for those, I would try to do your homework if you can with an internet search and try to make sure it's a high quality KN95 masks. Those are going to be much more effective at preventing you from catching the infection than a surgical mask or a cloth mask. How effective the general public wearing cloth masks is, I don't know if we really have data on that.
Is the vaccine causing people to have strokes, nerve damage, dementia-type symptoms?
There's always rare reports of reactions to the vaccine, so I would not say no to that, having not, just researched it within the last 5 minutes. But again, these vaccines have been given to millions and millions of people, and we are not seeing a statistically significant increase of any major problem after receiving the vaccine. Just remember, if you give a vaccine to millions of people, those millions of people were probably going to have a stroke or a heart attack for other reasons. And so what you have to do is you have to see if it's at an increased number in people who receive the vaccine versus those who don't. And so again, I'm not aware of any real significant life-altering reactions to the vaccine that have been proven to be an increased number. Great.
Since some are vaccinated and hospitalized, is one vaccine proving to be more effective based on hospitalization rates?
Not necessarily. We're still learning. These breakthrough infections are kind of new with the Delta. Well, not new, but more frequent with the Delta variant. I can tell you that all these vaccines are much more effective at preventing death and severe hospitalization. And so, like I say, when we get, let's say, 10 patients admitted to the hospital with COVID a day, which has been the norm here for a few days now, and we go and we see all 10, if 2 of them have been prior vaccinated, I can tell without being told that they're just much less ill and much less sick. So definitely, and they go home faster. So it definitely decreases the rates of a hospital admission, decreases the severity of illness, and then in turn decreases the death. And I can back that up. This Delta variant went through England, and England is a country that had very high vaccination rates, and they still had a large number of cases, which was concerning because they were very highly vaccinated as a population. But the mortality, which is the death from the vaccine, was like 90% less in England than it was the last time the virus spread through that country, showing that having a population that was vaccinated really decreased the death rate and made it more of a mild virus than a deadly virus.
Great. Do you have a recommendation on which vaccine people should have?
So the Moderna and the Pfizer vaccines, which are the RNA, the messenger RNA vaccines, they are more effective at preventing illness. They were originally 90 to 95% effective at preventing the last strain. And like I said, they're probably around 80%, 85% effective at preventing breakthrough infections with the new strains. The Johnson & Johnson vaccine from the get-go, while it was one shot, which was attractive to many, was never as effective at completely preventing illness, but it did prevent the severe illness and the death just as much as the others. So it really doesn't matter it really matters whether you prefer one shot versus 2. But if you are going to get vaccinated, I tend to prefer the 2 shots that have the higher rate of preventing illness.
Are antibodies as effective as a vaccine?
So by that question, I'm not sure if they're talking about monoclonal antibodies or natural antibodies. I think we answered the question. I think natural antibodies are just as effective as the vaccine. If we're talking about monoclonal antibodies, they are not as effective as the vaccine. That's a kind of a emergency use authorized treatment after the fact. Now, I think that they're very helpful and they're very good. And if you caught COVID and especially if you had risk factors for a severe outcome, I would highly recommend them. But I do want to make the point that these monoclonal antibodies, while they do decrease hospitalization and death, much like the vaccine is more effective at that. And also, it's emergency use authorized as well. And so we see a lot of people who are choosing not to get the vaccine because it's emergency use authorized, and so they consider that experimental. It's not really experimental. They've been studied and known to be effective. Yet when they catch COVID, then they rush in to get the monoclonal antibody, which is actually an infusion, for a half an hour of a product that's also emergency use authorized. And so I guess what I'm saying is if your hangup is the emergency use authorized criteria, I would still go for the vaccine to prevent the infection rather than wait and see if you catch it and then go get the monoclonal antibody. In addition, that monoclonal antibody is being used so much now, we might start to get in short supply, so it might not be available if you need it.
What are the numbers of breakthrough cases?
So I think we talked about that. It's about 20% if you're exposed with most of the vaccines, and so the numbers for that will vary based on how many people are vaccinated. So if you have a 100% vaccinated population, well, then a lot of the cases will be breakthrough vaccines. And so, right now, still this current outbreak of the Delta strain, it's driven by the unvaccinated. Almost everyone admitted to the hospital is unvaccinated. By far, most of the people in the ICUs that are dying are unvaccinated. So,
would you recommend vaccination for children aged 12 to 18?
And so I've avoided giving a definitive answer for that because, as I said, the infection to this point has been very, very mild. So even though the vaccine has limited side effects, if the infection was mild, then I would say it was up to the parents to choose. If your child is going to school and you're concerned about being spread in school, then by all means, I would get the vaccine, especially if you're concerned. So as a parent, I would have no hang up to give a child 12 and over the vaccine. I just want to be clear about that. As far as recommending everyone whose child is over age 12, I think parents should make that choice. And I also think we need to see how severe this Delta variant is. If we are seeing particularly kids with asthma, moderate to severe asthma, and obese children have some more severe infections, and they're requesting monoclonal antibody for those kids. And so if it is more severe in teenagers, then definitely I would go and get the children vaccinated.
So there's a theory circulating that there's a chip included, a microchip included in your vaccine. Can you address that?
I have no idea how they would make this microchip and what it would do and why they would do that. So I don't think that there's any grounds to support that theory.
So is the vaccine safe for people with autoimmune diseases?
I do believe the vaccine is safe for people with autoimmune diseases. I have seen some reports of potentially some higher side effects in that group. But I really think that not that it's not safe, but people with autoimmune diseases who are on immune suppressants have a much more likelihood of not responding to the vaccine. And I do want to make that point. So it's a good question. If you're on immune suppressants, steroids is one, but if you're on injectables for autoimmune diseases that alter your immune system, I would definitely ask your doctor to check you for the spike protein antibody, which is what you would make if you had a successful vaccination. I definitely would recommend your doctor check that, and if it's low, get a booster. So we do want to start targeting people who may not have responded to the vaccine, and that includes transplant patients and patients on medications that alter their immune system.
There's another theory that once you receive the vaccine, it changes your DNA. Is that true?
No, that's not true. So the messenger RNA strands go into the cell. They don't incorporate into your body's DNA, and they're just read, and then the protein is transmitted. And so I just want to make the point. So old-fashioned vaccines, they would have like killed virus or attenuated virus that would go into your body, and your body would like figure out how to make the antibodies against these proteins anyway, and it would just be injecting the proteins in your body. The end result of all of this is your body makes a messenger RNA to build a protein, which is an antibody, to attack the virus. I do want to make a point too on there's a fourth vaccine that may be coming out, which is a little bit more old-fashioned. It is an attenuated form of the virus, so it's a virus that's not capable of making you sick that's injected into you. If that gets approved, then perhaps people who are worried about this newer messenger RNA and DNA technology, that would be more of a quote-unquote old-fashioned vaccine where you're given a mild or unable to attack you form of the virus, and then your body makes its antibodies from that. Hopefully that'll be approved soon.
We kind of answered this earlier, but we've got some new viewers. How long after receiving vaccination will you begin to make antibodies? And is there a way for you to test to see what your antibodies are?
Yeah, so those are great questions. So you start making antibodies immediately. You're considered fully vaccinated 2 weeks after the last shot. And so if it's a one-shot series, then 2 weeks after that. If it's a two-shot series, 2 weeks after the second shot. You do get some good immunity from that first shot, but that second shot gives you more lasting immunity. There is a newer approved test called the spike antibody protein. That is the test to see if you responded to the vaccine. And I do recommend getting that in people who are on immune suppressants, again, particularly people who've had transplants or are on chronic immune suppressants. Now, does everyone in the general public need to rush out and get that test? No, and if they did, we would run out of it and not have it for the people who really needed it. I would say if you have a normal immune system, as far as you know, and you're a healthy person in general, and you felt side effects from the second vaccine, like feeling fever and chills and not well for a few days and achy, well, you can be pretty much assured that you had an immune response and you wouldn't necessarily need to be tested.
What is that fourth shot called?
I forget the manufacturer. I forget if it's Abbott or it's another company, but I'm sorry off the top of my head. I'm not coming up with it. Yeah.
Absolutely. We have another question. What about a 13-year-old that has heart issues and type 1 diabetes?
Yeah, absolutely. So let's readdress to children. If you have children who have risk factors to do poorly with COVID, which are the same risk factors in adults, such as obesity, poorly controlled diabetes, cardiac disease of any form, pulmonary disease, particularly poorly controlled asthma, then absolutely I would recommend those children get vaccinated. The disease could be much worse. Again, the vaccines are proven to be safe in that age group.
Why do some people have more severe adverse reactions to the vaccine than others?
So I think people have more severe reactions than others because our immune systems are different. And that's the bottom line. Everyone reacts to things differently. However, some people who have more severe reactions may have actually had COVID before. So again, that's one of the reasons why they say wait 3 months after the monoclonal antibody infusion or wait 3 months after your natural infection to get it, because you could have a lot of antibodies that are hanging around, and if you stimulate them even more, then you might have a more robust reaction. So that's another reason why, again, I'm a little bit hesitant to say everyone who had COVID, again, especially if you've had a normal immune system, should rush out and get 2 vaccines right at 3 months. You might have a lot of side effects with that second shot. That's a nuance that I particularly wish that people who are doing research nationally and the CDC would readdress, because I think people have really good immunity if they got over their natural infection.
We have a couple more questions left, and then we're going to wrap it up. If the vaccine works, why do we have to continue to wear masks and practice social distancing?
So again, that's a question that I'm not going to kind of step into the political arguments of whether or not the state has a right to force you to wear a mask. I said what I said earlier about not wanting to catch it. If you don't want to catch it, the N95 or the KN95s are superior to other masks. I also think that people who are vaccinated with a normal immune system, who, like I said, had those side effects after the second shot, so they kind of know they made the antibody, if they don't have symptoms, they probably don't need a mask because they're probably not going to spread it. I think anyone who has symptoms, though, and even if it's a mild breakthrough infection, could potentially spread it. And so I would encourage everyone who has symptoms not to go out in public. And that would be the group where a mask would be helpful. If people are going out in public because they're mildly ill or, oh, it's just a sinus infection, that would be where everyone wearing a mask would be helpful, because those people could be spreading it with their mild symptoms and not know it. And so that's kind of what my piece to say on masks.
And I might mispronounce this, but what are your thoughts on the Ivermectin treatment?
I am neither a proponent for or against ivermectin. I think like ivermectin and hydroxychloroquine and melatonin for that matter and Pepcid, these are all medications that are used for other things. And in the lab at very, very high concentrations, the virus doesn't grow as much. And so that's why they're theoretical. But the amounts of ivermectin on the plates in the lab that prevent the virus from growing are much higher than you could ever achieve in your body from taking ivermectin pills. So I know a lot of people who have testimony that I took ivermectin and I got better. But remember, 90 to 95% of people are going to get better. So they could have taken anything and gotten better because they were going to get better. I gave ivermectin to a lot of people early on, before it was even in the news as a potential treatment. And I did not feel like I personally saw a difference. I gave it to hundreds of people, or maybe not hundreds of people, but gave it to enough people to where I didn't see that people who got it were getting better any faster than people who weren't. If it does have a role, it would be very early on in the illness. And so I don't think that it's the standard of care to give people ivermectin. So I'm not really a proponent for or against it.
This is a tough one. If unvaccinated and vaccinated can spread and get the virus, then why are the unvaccinated people being pointed out as the problem of the virus spreading?
So a vaccinated person is far, far, far less likely to spread it. Like I said, right off the bat, 80% of them won't even catch it. You see a lot of these people who are tested without symptoms, and they might have the virus in their nose, but that doesn't mean they're contagious. If they don't have any symptoms, they're not coughing it, they're not spreading it, they're vaccinated, they're going to deal with the virus. And even people who have these mild breakthrough infections, they may be able to spread it. And I know the CDC shared that data as a reason for quote unquote everyone to wear a mask, but that's the exception, not the rule. They're going to be less contagious, they're going to have the virus in their body less, and they're going to get better faster. So the unvaccinated people are the ones that are getting infected at much higher numbers, and they're the ones that's driving this latest outbreak for sure.
And one more question. These are for our healthcare providers and personnel. Do you recommend a booster vaccination for healthcare providers, especially if they receive their vaccination at the end of 2020?
So again, we don't have great data on that. I think booster vaccinations are coming for everyone. And I think if you're concerned that you have your immunity is not there, right now I would prefer that we do it with a little bit of science and get that spike protein antibody and look at the level and then decide whether or not a booster is needed, rather than right now recommend a booster for everyone. But that may come soon. That may actually come soon.
And do you have any final thoughts, Dr. Conger?
No, I just, the science keeps changing. I'm doing my best to answer the questions as honestly as I can, based on a lot of personal experience and continually reviewing the literature. Things could change, and something I say today might not be correct tomorrow, but I'm just doing my best to give you, the information to the best of my knowledge at this time.
We appreciate your time, and thank you everyone for tuning in.
Thanks.